Active insufficiency, decrease in the torque produced by the two joint muscle or multiple joint when full range of motion is attempted simultaneously at all joints crossed by it. Example, the effectiveness of finger flexor is increased in the wrist extension than wrist flexion. An example of active insufficiency at the wrist occurs when attempting full finger flexion while simultaneously flexing the wrist. As the muscle crossing both joints, finger flexors and wrist flexors become too short to generate sufficient force. Passive insufficiency, two joint or multiple joint muscles are of insufficient extensibility to permit full range of motion simultaneously at all joints crossed by it. Example of wrist, when the wrist is in extension, finger flexor are stretched there, so there occurs finger flexion. And the other example is hip. If hamstrings are stretched over fully flexor hip, they limit full knee extension. Example of passive insufficiency in the wrist is the inability to achieve full finger extension when the wrist is fully extended, as the long finger flexor muscles are stretched across both the wrist and finger joint. Passive insufficiency of hip flexors occurs when the muscle, like the rectus femoris, is stretched to its fullest extent across both hip and knee joints, limiting to fully extend the knee or flex the hip.